Hello beautiful people, welcome back to my channel. I'm still your favorite nurse Gold. All right, still remember to subscribe to my channel, comment and share, and make sure you're watching this video fully, especially if you are a student nurse, if you are preparing for your OSCE examination in UK. Are you a practicing nurse or midwife? This video is for you. All right, so today I'm going to be talking specifically on management on impaired mobility. Okay, if you are doing diabetes in your OSCE exam, is for you. You are going to use this video for impaired mobility in case if you have a patient that is at risk of fall or any patient that is making use of walking aid. This video can be of help to you. Okay, so guys, let's dive into what we have today. Okay, so number one of what we have today is Mr. John is having impaired mobility, evidenced by the use of cane. Okay, but if they told you that your patient is not using any cane, that is finding it difficult to mobilize, you can just say that Mr. John is having impaired mobility, or Mr. John is experiencing impaired mobility. Okay, and then our nursing aim is Mr. John will be able to mobilize safely within his limits of his present condition after nursing intervention. Let me come again, please. Mr. John will be able to mobilize freely within his limit of his present condition after nursing intervention. Okay, and then the evaluation day. Mr. John will be re-evaluated today, 10/2/2025, after 30 minutes of nursing intervention. If this person is in the community setting after 30 minutes of nursing intervention, but if this person is in the hospital setting, you will say every 30 minutes or every 1 hourly of nursing intervention. Hope you can see the difference. All right, and then we move over to proper management, which is the A mat read. We are going to start from E. Is explain all aspects of nursing care to John and gain consent for all the nursing intervention. You can see how simple it is, all right, using this acronym EMAT-READ. Okay, and then the next point is M. Monitor John's vital observation as per new score of 1 every 4 to 6 hourly and escalate according to NISTU policy. This is depending on the new score you got when you are doing your assessment. Okay, so monitor John's vital observation as per new score of 1 every 4 to 6 hourly and escalate according to NISTU policy. All right, and the next point is, after you must have monitored the patient, is now assessment. You assess Mr. John for risk of fall using 4 risk assessment tools. Okay, and then after this assessment, you now assess John for correct use of walking aid such as cane, depending on what the person is making use of to mobilize. All right, and then after this one, you assess John's independence in self-care and in activities of daily living. All right, okay, I think that is it for assessment A. All right, then under next point under T is teach John the correct use of walking aid such as cane. Teach John the correct use of walking aid. Next is teach John to maintain free cluster environments to prevent fall. Okay, and T again, you teach John to seek for assistance if need be. All right, Teach John to seek for assistance, especially in activities of daily living, if need be. Okay, and then we move over to the next one. After teaching, under T, we still have teach John the indication and side effects of his prescribed medication. Okay, then we move over to A. A is administer John's prescribed medication and monitor its effectiveness after 30 minutes of administration. This is it, very simple. Okay, and then next point is to refer. You refer John to physiotherapist and occupational therapy for expert management through general practitioner or GP. Okay. Next point is inform John to use call bell and ensure that that call bell is at his reach. Listen, this is if the person is in a hospital, but in a situation whereby your question is saying that you are doing a community setting, you can just say inform John to call emergency number like 111 or 999 if there is any concern. Okay, and then you now document all care given to John with date, time, and sign. That is all for immobility, impaired immobility. Okay, hope I've done justice to this. Please guys, make use of this video. It's going to help you generally in any of your examination. All right, thank you so much for watching my video. Still remember to share this video to beautiful nurses and handsome nurses out there. All right, go chooks, love you guys so much. Thank you.